So how does plastic surgeons decide where to put fat during a BBL? Most people think that it's about putting in as much fat as possible, but really it's all about getting the proportions right for that individual body. And so here's what we look at. Every single body has different proportions when it comes to the waist transition to the hips, where that booty kind of hangs out, and down to the thighs. So you have to map out where exactly that person, each individual person, whether they're 5'10 or 5'1 or whatever, where their waist is, where their hips actually are, where that transition area is, where the transition to the thighs is, where that booty is. So it's not about maxing out all these areas, but you are trying to make the biggest difference in all these areas as you can. We're trying to make that waist as small as possible with a bunch of lipo. We're trying to put in a good amount of hips so that we can get them out an hourglass, when we're trying to put a good amount of booty because we know that some of that fat's going to reabsorb. But really the most important thing is making sure all these areas transition properly and smoothly, and they match each person's individual anatomy so that whether that person is 5'1 or 5'10, that it all flows properly around their body and it's proportional and balanced.